everyone, welcome back to my channel. I'm Sheila G, the PAC, and today's video is going to be all about Hidradenitis Suppurativa, or HS for short. Now, this is a physically and mentally debilitating skin condition for so many people that suffer from it. So I wanted to talk about the cause, the clinical presentation, medical treatment, and ways to improve the condition through lifestyle choices. For all things dermatology, don't forget to like, comment, and subscribe to my channel. Let's get right in. So HS is a chronic skin condition that involves inflammation and the formation of painful nodules and abscesses in, more commonly, the intertriginous areas, so under the arms, the breasts, the groin area, and the buttocks. Now, we don't have an exact cause of HS, but what we do know is that the hair follicle and the apocrine sweat glands become obstructed, and so they get very clogged. And so basically they get clogged up with dead skin cells and natural oils because they're not shedding appropriately. And so in response to that, the immune system just creates this inflammatory response. And so we have the formation of painful lumps. So another thing though that can happen when these structures are chronically obstructed and they're not shedding appropriately, when they fill up and kind of balloon out, they can rupture, and the contents get leaked out into the surrounding tissue, and that can cause an abscess where it may drain pus. So in more severe cases, those nodules and abscesses form in clusters, and then they start to connect with one another through sinus tracts, so little formations or interconnections between them. And over time, with chronic inflammation, that can lead to a lot of scarring and fibrosis. So HS can affect both men and women, but it is slightly more common in women. HS tends to be progressive. So what that means is it may start in one location of the body, but then start to appear in another location, especially if it's not managed early on. Now, HS can affect anybody of any race, but it tends to be a little bit more severe in those of Hispanic or African American descent. There are several factors that may contribute to the development of HS, first being genetics. So those who have a positive family history of HS are about 20 times more likely to get the condition themselves. There are also some genetic factors and mutations that may contribute to that dysfunctional immune system where we see that exaggerated inflammatory response. Another huge thing is obesity. Obesity is very much linked to the development of HS, and it is a significant risk factor. And then we have smoking. So smoking itself can be a risk factor for the development of HS, and the poor circulation due to smoking also contributes to worsening flare-ups. Those who have high cholesterol, diabetes, high blood pressure, or any metabolic syndrome are also more likely to develop the condition. Let's go back to the clinical features of HS. As previously mentioned, there are tender, inflamed nodules and abscesses that may or may not drain pus. Now, in more advanced or severe cases, we can see fistulas or sinuses that connect larger groups of nodules. We can even start to see big scars like keloids, or even band-like scars where there are the fistulas or connections, and that can be pretty difficult to treat at that severity. So we have a staging system for HS known as the Hurley staging system that we use to guide our course of treatment, where stage 1 is the presence of nodules and abscesses, typically in one location of the body, and they do not have any sinus tracking or any signs of scarring. And then we have stage 2, where there are multiple nodules and abscesses, and that can be in one location or multiple locations, and we start to see early signs of scarring and the presence of sinus tracts. Then we have stage 3, which is the most severe stage, where we see extensive nodules and abscesses in multiple locations of the body with more advanced scarring and those interconnections or sinuses. And at that point, there is a severe impact on the patient's quality of life. So we can see mobility issues. Patients experience a lot of anxiety, depression, and they're in a lot of discomfort. So that's definitely the stage we want to avoid. And this leads us to the treatment of HS. So as far as medical treatment, it kind of depends on the severity, but in general, we like to start with oral antibiotics along with topical antibiotics. As far as oral antibiotics, we do prefer the tetracyclines. So doxycycline is more commonly prescribed, and that is taken for about 2 to 4 weeks for flares of HS, depending on the severity. Now, we often combine oral antibiotics with topical antibiotics to control the bacteria on the skin. So we often prescribe clindamycin, gentamicin, or mupirocin ointment to be used every day. Now, another important thing as far as the treatment and maintenance of HS is using a really good cleanser, a body wash. So ones that we recommend include Hibiclens, which is chlorhexidine, and that's an antiseptic cleanser. Another good one is Panoxyl, which is actually used for acne as it contains benzoyl peroxide, which is also antibacterial. So another thing that can be done for those who have very large and painful nodules that need more immediate relief, we can go in and inject each one directly with a steroid solution, and that helps calm down the inflammation more immediately and helps with discomfort. So for more severe disease, so stages 2 to 3, we may also consider biologic medications, which help to not only control the active HS, but can prevent flares of HS. So the 2 biologics that we use in dermatology for HS include Humira and Cosentyx. Now these are injection medications, not right into the HS areas, but these are injections either into the thigh or the abdomen, and they're systemic, so they act on the immune system. Now, both of these, Humira and Cosentyx, are actually used to treat psoriasis as well, but they have been indicated now by the FDA for the treatment of moderate to severe HS. So Humira and Cosentyx have slightly different dosing schedules, but again, both are injection medications. Now, to start a medication like Cosentyx or Humira, some blood work is required, as we do test for what's called opportunistic infections, so tuberculosis and hepatitis. So surgery is the most aggressive option for those with more severe cases of HS, and that's where a surgeon goes in and actually removes the affected hair follicles and sweat glands within one area. Now, do keep in mind though, that doesn't serve as a cure for the condition, as it's chronic in nature, so new areas can be affected. So laser ablation is a less invasive option that can be utilized to basically target and destroy those affected hair follicles and sweat glands. So as far as lifestyle modifications, weight loss for obese patients will not only improve overall health, but it can significantly improve disease severity in those who are affected by HS. Another important thing is to try to manage frequent sweating, tight clothing, and avoiding friction. We do know again that smoking is a big risk factor for the development of HS and the severity, so quitting smoking is very important as well. Another thing that I recommend to some patients when they're trying to maintain the skin after controlling flare-ups is gentle chemical exfoliation, maybe 1 to 2 times a week. And that can be done with an alpha hydroxy acid, or even something like salicylic acid, which is a beta hydroxy acid. And the reason for that is we try to avoid that follicular plugging. So we try to basically unclog those hair follicles and the sweat glands, and that's one thing that can help. So there you have it, the diagnosis and management of hidradenitis suppurativa. Thank you guys so much for watching. I really hope you found this video helpful, and if so, don't forget to like, comment, and subscribe to my channel. I'll see you next time.